was awesome weather we're having today.
Oh,
People want us to talk about the weather
they do.
or sports.
Or to,
How about the Reds?
know a thing about the weather better, Florida, right?
We would know.
It's
You were
always-
just there.
well,
Right.
As the oh so tan girl points out, the weather was so nice.
I was in Florida, and I had more tan before I went down.
Everybody kind of jumping on, so we're just waiting on a few more people. Does anybody have any eye jokes?
I don't have any eye jokes. I'll have to tell my pirate joke. That's my go-to joke. Jess, why are pirates called pirates?
Oh, wow. I have no idea why.
They just are. Oh, that was awful.
That was.
We just lost half our crowd, Jess. They just said no.
They're
no, no.
actually finding out.
As I go.
Yeah,
Trickling
we're
off.
doing the,
If you're gonna tell
thumbs
bad
down,
puns, then that's it.
Cry
So,
emoji.
Yeah, yeah, there we go.
Not
Yeah,
the laugh
not the
cry.
laugh
Not the
cry,
laugh,
those
cry,
kind
just
of
the
cry.
cry. Like I can give this to you.
About 20 people
Very good.
in the chat room. Hi, everyone. My name's Lakin. I'm one of the surgery coordinators here. And this is Dr. Knowles. He is one of our surgeons. Jessica, who is a cataract coordinator. We have Dr. Brian Stahl and Dr. John Gillis. And they're going to go over some things about cataract surgery and RLE with you. You guys just want to take it away?
Thanks, Lakin. Hey, Jess.
Hey, how are you guys?
Good, good.
All right. So we first want to start by getting to know all the doctors a little better. So Dr. Stahl, why don't you tell us about yourself?
Yeah. Hey, I am Dr. Brian Stahl. I actually grew up here in Dayton, born in Beaver Creek, but I did all my training up at Ohio State. Big Buckeye fans here. Have lots of Buckeye rooms and things like that. I was an eye doctor as my dad was before me. He was an optometrist, but now I practice as an eye surgeon. So I did all my training at Ohio State. Stahl Vision actually founded 30 years ago. We founded Stahl Vision. We've got multiple partners. We have a surgery center, a LASIK suite, but I've been practicing here in Dayton for 30 years.
Wow. Okay. Dr. Knowles.
All right, I am a Air Force trained ophthalmologist. I did med school at the Mayo Clinic in Minnesota, and then residency in aerospace medicine. And then after that, residency in ophthalmology, also in San Antonio, Texas. Was head of the Department of Ophthalmology at the base, and then joined Dr. Stahl after I exited the military about 2005. And so I've been with him for about 19 years. And yeah, so that's my background.
Hey. Dr. Gillis.
Thanks, Jess. I'm Dr. John Gillis, and like Dr. Knowles, I come from an Air Force background. Like Dr. Stahl, I'm also a second generation eye care provider. My dad was an Air Force ophthalmologist, and so kind of in his line, I went in. I did my undergrad at the University of North Carolina at Chapel Hill, so I'm a Tar Heel. Then I went to the military med school and did my residency in ophthalmology down in Texas, like Dr. Knowles, and just recently got out of the Air Force this past summer at Wright-Patterson, where I was chief, just like Dr. Knowles, and was happy to find a great landing spot here with Stahl Vision. And my 1-year anniversary will be coming up this summer.
All right. Well, good. We're glad to have you. Let's jump into some questions, frequently asked questions about cataracts.
Let's, Jess.
What is a cataract and how does it affect your vision?
Yeah, it's actually a really good question because we hear that a lot. And the thing with the cataract is as we all get older, our lens starts to yellow, turns brown, it gets a little cloudy. If we all live long enough, we're all going to get a cataract. The cataract is where that lens gets cloudy. And when you call it a cataract is where it gets cloudy enough that it starts to interfere with your vision. For most people, that's somewhere north of age 50 or so.
Okay. Dr. Knowles, what are the common symptoms of a cataract?
Yeah, so that's a great question. The common symptoms are blurred vision. I mean, just decreased vision, especially nighttime driving vision, difficulty with glare, headlights coming at you, that sort of thing. Not able to see the road signs from as far away as you used to. And despite changes in glasses, that vision doesn't seem to be getting better. And those are probably the biggest signs or symptoms of cataract surgery, just blurry, slowly progressive, blurry decrease in vision.
All right, thank you. Dr. Gillis, at what age do cataracts typically develop?
So typically, Jess, they develop in the 60s and 70s. But if you have other conditions like diabetes or other health conditions, sometimes they can present in the 50s, but also in the 30s and 40s occasionally. So,
Mhm.
but for most people in their 60s and 70s is when most people are ready and choose to get their cataracts removed.
Okay. Dr. Stahl, can cataracts be prevented?
You may be able to slow it down. As we talked before, if we all live long enough, we're all going to get cataracts, we're all going to need cataract surgery. But several studies have shown that if you're taking multivitamins with minerals, if you're living a healthy lifestyle, you're eating more fruits and vegetables, you may delay or slow the onset of cataracts. So I encourage all of our patients to do all those things. Take your multivitamins, eat your fruits and vegetables like mom told us to do, and get some exercise and live a healthy lifestyle, and you may keep your eyes healthier.
Okay, good to know. Dr. Knowles, how do you diagnose a cataract and what should patients expect during their evaluation here at Stahl Vision?
Yeah, so the way to diagnose cataracts is to have an eye evaluation from your eye care professional, typically an optometrist. They can do a dilated exam, etc. And if they find a cataract that is causing symptoms that you're complaining of, and they feel like cataract is the main decrease in vision, then they're very likely will refer you to us as an eye surgeon. And during the evaluation here, we will dilate your eyes, we'll check your vision, both undilated, and also we'll do some testing with glare testing to kind of simulate headlights coming at you, that sort of thing, to see if there is true degradation in the vision. We'll have you answer a questionnaire, and then we do a thorough eye exam. It can take, an hour to an hour and a half to up to 2 hours possibly. And we do a lot of different testing, and in the process, we're trying to find out, is there any other disease going on or any other issues that could be causing decreased vision? Is there a cataract there, and is the cataract severe enough that we feel like that would be maybe the main cause? And if everything else turns out that the eyes are healthy, there's no other issues, and it's primarily cataract, and it's significantly affecting your daily activities, then that next step would be to consider doing surgery.
Okay, thank you for that. Dr. Gillis, how do you determine when cataract surgery is determined or necessary?
Sure. So as part of the evaluation that you'll get for your cataract consultation is that thorough eye exam. And part of it is just us talking with you about how you're doing with your vision. And if you're starting to struggle with the things you need and want to do, like driving, reading up close. And part of that will simulate how your vision is at nighttime by shining a bright light at you. And sometimes people, even with 20/20 vision, their vision will go to legally blind with those bright lights. And that simulates nighttime driving or driving in the rain. Many times people struggle with those types of things and they need to be able to do those. And those would be really good indications and reasons for pursuing a cataract surgery.
Okay,
Mm-hmm.
I am, but they say my vision's perfect, so.
You are perfect, yes.
Dr. Stahl, what are the different types of intraocular lenses used in cataract surgery?
Yeah, you hear that question a lot, and that's because things have changed a lot in the last 20, 30 years that I've been practicing. If you were not able to have an implant lens in your eye, you would have to either wear a Coke bottle thick glasses lens or a contact lens to see clearly. So everybody gets an implant lens, but those lenses have gotten a whole lot better.
Yeah.
So we have lenses now that correct for astigmatism. You probably have some astigmatism, you have it in your glasses or contacts. We can correct that in your implant lens. And we have multifocal or bifocal implant lenses. So unlike yesteryear, where you still had to wear your bifocals after cataract surgery, now a lot of our patients are going without their glasses, both distance and near. And unlike your bifocals where you have to look down to look through the bottom part of your bifocal, it's not like that. You can see through the top and the bottom, distance and near, fairly good for intermediate. So we're now in our 6th generation of these bifocal implant lenses, and they've gotten really pretty good. We see a lot of our patients, probably more than half our patients, choosing a specialty lens, a premium lens, that will allow them to see better without their glasses and contacts.
Wow, that's amazing. Dr. Knowles, what is the recovery process after cataract surgery?
Yeah, so after cataract surgery, that's a great question. After cataract surgery, we see the patients on day 1, and that'll be a vision check, pressure check, look at the eye, make sure the lenses, everything's behaving itself the way it's supposed to. And then we'll see you typically about 2 to 3 weeks after that. And so the recovery process, your vision can be improved pretty rapidly. Many people are resuming driving within a day or 2 after surgery, resuming work and regular activities pretty rapidly. We do have some limitations on vigorous activity, no lifting more than 40 pounds for the first week or so. And we go over a lot of different medicated drops to help you with the healing process. And then if all that is going well, which it typically is, Then at about 2 to 3 weeks, we do our final check and then move on to doing the second eye if it's needed.
Dr. Gillis, do the cataracts come back?
Just as a common question, people want to know, is this a one-time thing or am I going to be doing this again in 20 years? And
Mhm.
the good news is it's typically a one-time operation. And the other question they ask is, how long is the implant good for? And the answer is the rest of your life, as long as it's in a good position. So typically the implant goes in, the cataract's removed, doesn't grow back. What can happen though, and sometimes is that a little film can develop behind the lens over time. And that can be as soon as a few months after surgery or even decades after. And that the good news is it doesn't require another surgery. It's a simple laser procedure that we can use to remove that film that develops behind the implant lens to make it clear again if that develops.
Okay. And Dr. Stahl, how soon after being diagnosed with cataracts does someone consider having surgery?
Yeah, when to have cataract surgery is a very individual, personalized decision. But basically, if you're not happy with your vision and you're wanting to see better, then it's time to have cataract surgery. Some of you may have heard this old phrase, it hasn't been really common or used for 10 or 20 years, about the cataracts have to be ripe.
Mhm.
Cataract doesn't have to be ripe. You choose surgery when you're not happy. Now, a lot of times people wait too long. As a lot of my patients have cataract surgery,
Yeah.
they come back and say, "Gosh, I wish I'd done this years ago. I didn't know how bad my vision had gotten." We do have an online quiz that you can take on our website that asks you some of the questions that hints that you might have cataracts. But basically, if you're not having problems with your vision, you don't need cataract surgery, but it works the other way around. If you don't feel comfortable driving at night anymore, if you're struggling to see your golf ball, if you're having trouble turning left in the rain at night, if you're having these sort of problems, then you may have cataracts and it's maybe time for cataract surgery.
Okay.
And I don't give golf lessons because anybody who's played golf with me knows that my golf game is not very good.
Dr. Knowles, what factors should patients consider when choosing an IOL for surgery?
Yeah, so an IOL is, is an intraocular lens, and there are choices available now that weren't available 20, 30, 40 years ago. Used to be you just put in a lens and hope that they wouldn't have to be in too thick of glasses. But now we've got three basic categories. One is a standard lens, the other is a toric or an astigmatism correcting lens, and the other is a multifocal lens. So it kind of depends on several things. One is your personal needs, your personal wants, what visual expectations do you have after surgery. Then also that's coupled with the health of your eye. Some people have conditions going on that prevent them from having certain types of lenses. And the only way we can determine that is to do that thorough eye examination. And then we'll have that discussion. It's an individualized choice. If somebody is eligible for any lens, and it kind of boils down to what they want to be able to see and do, and how much spectral independence do they want afterwards. So there's a lot of factors that go into that. We give you a very thorough discussion on the type of lenses and options and which lens may be best for you.
Okay, thank you. Dr. Gillis, what is the typical recovery timeline for or after surgery?
So the cataract surgery itself just takes about 10 to 15 minutes in most cases. Now, if you have a more advanced or difficult, challenging case, it may be a little bit longer, but the average is about 10 to 15 minutes. Usually most patients are pleasantly surprised at how quick and painless the procedure is. That first day, you're going to have some blurry and scratchy vision, which is normal, but we see it back one day after surgery. Then usually 1 to 2 weeks after that first eye, if both eyes are planned, that after that first 1 to 2 week appointment, we make sure the eye's healing appropriately and the eye's seeing well. Then we use that healing process to select the lens for the second eye and do the second eye typically 3 weeks later. And then kind of do the same process again with the drops and recovery for the second eye. And then you have your graduation appointment where we celebrate your new good vision about 1 month after the second eye.
Great.
Like I said that.
All right.
Right.
Dr. Stahl, is it common for both eyes to develop cataracts at the same time?
Yeah, most of the time when you get a cataract in one eye, you have at least a little bit of a cataract in the other. Again, we talked about earlier, we all live long enough, we're all going to get cataracts and we're all going to need cataract surgery. It's the most commonly performed surgery in the United States right now. But sometimes people have a cataract worse in one eye than the other. When we choose to do cataract surgery, we usually do the worst first, get that one working well, and then do the second eye. Now, some people, let's say if you had trauma in one eye and you developed a cataract after getting hit with a baseball or something like that, maybe you only need cataract surgery in the one eye. So certainly we only do surgery if you need the surgery. Most people will probably need both eyes done. And here in our office, if you have cataracts in both, we usually do one eye. We wait 3 weeks, let the first one heal,
Mhm.
see how it turned out, make some adjustments, and then do the second eye about 3 weeks after the first eye.
Okay. Dr. Knowles, how soon can someone notice improvement in their vision after surgery?
Yeah, that's a common question as well. And patients, many patients, most patients are noticing improvement right on day one. We've had patients, it's amazing. We've all had patients who are barely able to even see light and they have really, really dense cataracts. And wow, on day one, they could be seeing, not too far from that 20/20 line. So huge improvement. But the vast majority of patients their vision is not super bad like light perception, but they're noticing a big improvement within the first 1 to 2 days. And many are able to drive within a day or two after the surgery, resume typical activities, work, things like that. So there's not a lot of downtime, pretty fast recovery.
That's great. Dr. Gillis, does insurance cover surgery?
People always want to know what's it covered by insurance, and the good news is yes, it is covered by insurance. So it's a medical procedure, especially that's why we go through the extensive evaluation to show the insurance companies that yes, your vision is impacted by your cataracts and high chance of improving the vision. Now we talked about some of those advanced lifestyle lenses that get people out of some dependence on glasses, and there are some extra non-covered entities that may come outside the insurance parameters. But we go through all the different financing options if that's some of the questions or concerns you have with our coordinators who are really experts in how to get you the best lens for your eye.
Okay. Dr. Stahl, what advice do you have for someone who's undergoing surgery that may be nervous?
Yeah, I think most people are going to be a little nervous. It's
Mhm.
surgery after all. I guess I'd be a little worried about you if you weren't a little bit nervous.
Mhm.
And certainly for your surgery, you have an anesthetist with you. They're going to give you a little bit of sedation. You're still awake for cataract surgery. You can still talk to you, still breathe on your own. It's much
Mhm.
safer done that way. But the best thing is even from your very first phone call, a real human answers. It's not a computer answering the telephone, and you have to push through a whole menu of things. Got one of the friendliest, nicest staff. We've got excellent doctors and nurses. They're going to take excellent care of you. And it's a very much personal care, family kind of oriented practice. I think when people come in, they get that immediately as soon as they walk in the door. It's just a friendly place to work. And I've got an absolutely awesome staff. And that's kind of what you want. We know you're going to be nervous for the surgery. We know you're a little anxious because it is surgery, it is your eyes.
Right.
But when you come in, most of our patients say, oh gosh, the nurses and the staff, they just put me at ease and the doctor seems so friendly. It just makes it just an empathetic sort of place and people feel friendly. And that's the best you can probably hope for.
I agree. Dr. Knowles, if a patient suspects that they have cataracts, what is their first steps?
So again, you might suspect cataracts because you're having decreasing vision with nighttime driving, that sort of thing. And so you're wondering where to go first step. The first step is to get a professional eye examination, typically from an optometrist, maybe somebody you've been seeing over years or somebody who's close by in the neighborhood, that sort of thing, and have them do a full, thorough, dilated examination. They'll be able to determine if there is a cataract there or not. They'll also be able to determine is it significantly affecting your vision. And if they see one that it needs to have intervention, surgery, then typically they'll refer you to us or to possibly another eye surgeon, but anyhow, somebody who can do the surgery for you. So the best place to start is with a professional eye examination. Yeah, so that's that's the best place.
Okay, thank you. Dr. Stahl, do we have financing for those advanced lifestyle lenses that you guys were talking about?
Yeah, that's a great question. And Dr. Gillis addressed, for the exam and things like that, most of those things and the surgery are covered subject to copays and deductibles. And most of you have been through any sort of surgeries before, understand that in the insurance. We certainly accept most insurances. The only couple of insurances we don't accept are on our website. There's very few of them, certainly accept most of the insurance that you might know. But these advanced lifestyle lenses are a non-covered service. That's a fancy word for Medicare, and all the insurance companies don't cover that. Again, about half of our patients are choosing to do one of those, mainly because a lot of those patients are no longer having to wear glasses and contacts after the surgery for reading, not for distance for some of those patients. So we have great finance plans, no interest plans, and finance plans for that to make it fit within everybody's lifestyle and everybody's budget. So we want everybody to be able to get the implant they want, the implant they deserve, that they can see like they want after their surgery. That's a great
Right.
question.
Okay.
More questions, guys?
I don't know, Lakin, are there any questions coming in from the internet, from the web?
Cool.
Awesome.
Okay, so I know it's a little bit harder to hear me, but one of the questions is, how long do I have to wait to have my second
Or
eye
repeat that
done?
question.
And what about the imbalance in between?
Yeah, great question. So typically cataracts are bilateral, but oftentimes asymmetric. So you have the worst eye done first. We talked about that. And then typically we wait about 3 weeks before doing the other eye. And as Dr. Gillis mentioned, it's typically for safety and accuracy. We have some patients who come to us and they have very thick glasses or very strong contact lenses. And so if they have one eye done and say it's seeing very well at distance, maybe 20/20, they've got really, really thick glasses. They often wonder, can I pop the lens out of one side and keep the glass in the other side? And if they do that with really thick glasses, excuse me, they will end up with some imbalance, double vision, headaches, that sort of thing. So the best situation for that is if they're a prior contact lens wearer, they can still go back into their contact lens in the non-operated eye. So that's being corrected with the contact lens. Meanwhile, they don't need correction in their eye that just had the cataract surgery. And that can help correct that imbalance until we do that second eye. It's a great
Thank you.
question.
Very good question.
Helps to repeat
I
the
have
question.
another question
Okay.
that says, how long do I need to take off work for my workout?
Okay, so the question is from the group is, how long do I need to take off work or workouts? So yeah, very good question. We've got a lot of active, healthy patients, and they always want to know, well, when can I go to work? When can I go back to my routines? And so, like we had mentioned before, driving and kind of getting to day-to-day activities, walks, maybe a bike ride thing is pretty within the first few days. We limit heavy lifting about 40 pounds for that first week. And in addition, you'll be wearing an eye patch for the first week or two. From a work perspective, it depends on what you do. Many people that have work in an office or administrative or on a computer, they can resume work almost within the first few days. You know, we're happy to fill out FMLA paperwork and give people a week or so off work in certain cases if it's appropriate. But most people can get back to their jobs. Now, if you do work in a job that requires very heavy lifting or it's in a dusty or dirty environment, we want to limit the chance of an infection. And many times we'll advise you to hold off from work for about a week. But in almost every case, we're returning people to full work duties within that first week at the worst.
Yeah, I think Dr. Knowles and I do that same thing. Like if I do surgery on somebody on a Tuesday, probably don't want you working on Wednesday, but I have people go back to work on Thursday. And some people are able to drive the very next day. We like to see you first, make sure you're okay. And if you remember old fashioned cataract surgery, oh, you're not allowed to bend over and put your shoes, you can't take a shower. And this is not your grandmother's cataract surgery. You can take a shower that same day, you can bend over and put your shoes on, you can take care of yourself, you do normal activities almost immediately. And I think, John, you do what I do. For exercising, it's 1 week before you're exercising. And if it's a pool, 2 to 3 weeks, hopefully chlorinated water before you're back to the pool or back to the water.
Yep.
All right, I do have a couple more. Kristen would like to know what type of anesthesia is used during the procedure.
Yeah, so that's a great question, and I'll kind of answer it with a little longer answer. Okay, so the question is, what kind of anesthesia is used during surgery? And this is a topical anesthesia done as an outpatient. And if you think about things, there's anesthesia, which is a numbing medication. We'll put numbing medication on the surface of the eye. We actually put numbing medication inside the eye. Then there's sedation, and that is typically with some IV medication, typically Versed. Rarely, once in a while, maybe a little fentanyl, that sort of thing. And that helps you get a little sleepy, a little drowsy. You're kind of aware, but you really don't care kind of what's going on. Okay. And so it's a combination of those things, but it's outpatient surgery. It's not, you don't even have to get into a gown. Of course, the area around the eye is sterilized and cleaned and draped and that sort of thing. You have an anesthetist handling the IV sedation. Meanwhile, we're doing the anesthetic application on the surface of the eye and inside the eye. And people are very comfortable with the surgery. So it's not a high stress surgery.
Great answer.
Got a few more coming in. Okay, so I do have one that says, did you say that the advanced lifestyle lenses are not covered by insurance? What type of lenses are those for?
Yeah, so the question was, Tell me again about the advanced lifestyle lenses, the premium lenses, right? So the regular implant lens that most people used to get, you'll still wear your glasses most of the time, definitely for reading, probably at least a little bit for driving and distance vision. But about 20, 30 years ago, we came up with implant lenses that could correct for astigmatism. So just like you can correct for astigmatism in your glasses or in your contacts, that can be corrected for in an implant lens. And now we have bifocal or multifocal implant lenses that restore your near vision. When I was younger, I didn't have to push everything so far away and I could read up close. But now that I've gotten older, I have to put my reading glasses on to see up close or ask Jessica to read me things. She actually wants to go home at the end of some days. Apparently not tonight, however. So we have implant lenses that correct that. Those are non-covered services. We have finance plans and other things for that, but none of the insurance cover that. So you don't have to do one of those. There's certainly nothing wrong with a regular implant lens, but about half of our people are choosing to do it for lifestyle reasons because they're not wanting to wear their glasses and contacts so much.
And just to piggyback on Dr. Stahl's comments, if you think about it, insurance companies back in 2005, they made a decision. They said technology is exceeding our ability to help cover that for patients. So the basic lens allows you to have the cataract out, get better vision, but other things that affect that people want, they want to have their astigmatism treated. Well, the insurance companies, they said, well, we're not going to pay for that. If you want to have it, that's on your own. If you want to have range of vision, that's on your own. We'll cover the basic standard lens, and they do that very well. And those lenses are still very good lenses, but it basically becomes what does the insurance, what does the Medicare, all that industry, what do they want to help reimburse patients for? At that point, they kind of drew the line, and that line remains fixed since 2005.
Really great answer.
Yeah.
That was one of my questions. I know a lot of patients ask us over the phone. I think I said that was a really great answer to that question. I know a lot of patients ask over the phone why insurance companies don't care, or why wouldn't they care what your vision is after surgery? Because to them it would make sense they're no longer paying for glasses and contacts, but just not the way the insurance companies work.
Right.
Yeah. Well said, Lakin. Off camera, no less.
This one kind of goes with that, with the upgraded lens. So this one's from Robert. Robert wants to know if he can wear his normal glasses after the surgery. Two people that he knows that weren't our patients weren't happy with their outcomes because their normal glasses didn't work. Why wouldn't their normal glasses?
So the question was from Robert was he knew, or he's heard about patients that have tried to use their preoperative normal glasses after cataract surgery and they didn't work, and that was a source of frustration. And so that I'll address it from, I guess, what I'm interpreting it to be. So many people come into cataract surgery with cataracts, but they also come in with refractive error. And refractive error is just a fancy word for they either are nearsighted or farsighted, meaning they need glasses to help them with distance or up close, or both in many cases. So, and after surgery, when we take the cataract out and put the new implant in, we reduce that refractive error in most cases to give them good distance vision. So if the intent, if after cataract surgery is to get you back in glasses, most of the time you'll need a new prescription, and your glasses that you had beforehand won't be the right prescription. So that's a very common thing that people, and if the goal is to get a standard lens and go back in glasses, we help facilitate that. But many times, if you choose one of the advanced lifestyle lenses, you may not need glasses for distance, and you may just be either in readers, or if the multifocal lens is your choice, you may have a great range of vision and not need any glasses.
Yeah. And I just add to that, the best thing is to get it right the first time. And our practice works very, very hard with special formulas and measurements. We don't measure you once, we measure you 3 times to get the implant power right. The power of that implant determines what kind of glasses you're going to need and how thick your glasses. Now, everybody, when you have cataract surgery, your old glasses don't work anymore. They're not right because you've had surgery, you've changed your eyes. But the other advantage that we have is a refractive surgery practice. The implant gets you close, but as Dr. Knowles and Dr. Gillis and I know, sometimes no matter what you do, humans aren't titanium. We're not robots. We're going to individually heal, and you miss a little bit. Well, here, that's not a big deal for us. We can go back and do a laser vision correction tune-up, like LASIK and PRK. And even though the implant might get you close, we can get you closer. So sometimes we have people that come from the community that maybe had cataract surgery that aren't very happy with the result. We have them come see us and say, well, listen, they did a good job with the surgery. You're just still needing your glasses quite a bit more than you'd like. We can do a laser vision correction tune-up and maybe get you happier. So we see people from the community all the time. And I think the best thing is get it right the first time. We work very hard to do that at this practice. But if we're a little off, or if you're had surgery somewhere else and not happy, come see us. Maybe we can tune it up. Maybe we can make it better.
No, we do see patients often in our department that have come from other places that just really want to be out of their glasses a little bit more. Robert did say that he does have fluid behind one eye. Does he need to have it cleared up before surgery? Are there other types of things that you might want to clear up before surgery?
Yeah, so, so the question is, somebody in the audience said that they have fluid behind their eye or in the back of their eye, and would that affect the ability to have cataract surgery or timing of it, et cetera? Again, there are things such as diabetes or macular degeneration or other retinal problems that can cause fluid or thickening of the retina itself. And when we do the evaluation, the thorough cataract evaluation, we try to find out, are there other causes of decreased vision? A given patient may have 1, 2, 3, or 4 different causes of decreased vision. One of those causes might be fluid in the back of the eye and at the level of the retina. If we think that that is a significant contributor to their decreased vision, then we will oftentimes refer them to a subspecialist, like a retina specialist, to have them do treatment or at least evaluate the patient. And there may be a need to have other treatment done by a subspecialty ophthalmologist, like a retina physician, to get rid of fluid in the back of the eye so that the patient can have their best result from the cataract surgery. So the answer really depends on, is there fluid there? What's causing it? Is it progressive? Things like that. What's the underlying condition? And we work very well in close coordination with retina specialists in particular, because the retina can have issues that could affect outcome from cataract surgery. Long answer, sorry.
No,
Great answer. Very well.
So we've got some Gregs in the chat, 2 of them. This Greg is 62 and he struggles with headlights while driving at night. He did share it with his eye doctor, who confirmed that he does have cataracts over the past several years, but has never suggested a referral for surgery. Should I tell him I want it done?
So that's a very good question. So the question was, I'm having trouble with headlights and
Having some trouble, like signs and symptoms of cataract.
yeah,
Doctor confirmed he does have them.
Yeah.
Does he need to ask him for a referral?
Yeah, here. So the answer, here's because we see this from time to
That's
time.
good.
Okay, so your optometrist has the ability to do vision testing and to do dilation. They can see cataract. We actually, when we do our evaluation, we have the ability to do glare testing. We do other things that help determine how much the vision is affecting daily activities, that sort of thing. So just the fact that somebody sees cataract doesn't necessarily mean that it needs to come out. It may be that it can be compensated for by a change in glasses. So your optometrist may offer a change in refraction, change in spectacles to help improve the vision. But if they've given you the very, very best, most recent refraction, and you're still having significant symptoms that seem to be bothersome, then that's a situation where you may want to pursue a second opinion. And that second opinion is typically authorized by insurance and Medicare. And that second opinion could be coming to us, having us do additional testing that could help define and determine, is there a cataract that's significant? Many times we may say, we agree with your regular optometrist and you have cataracts, but they're not significant yet. Or we may find, the cataracts are there. And when we do the specialized testing, the glare testing, things like that, the vision really does come down and it does match your visual complaint. And then maybe cataract surgery is the next step. So the answer kind of depends, but glasses can be tweaked and changed for a little bit, but they can't be tweaked and changed a lot when cataract is getting worse. So always have the option for a second opinion. We're happy to provide that.
Most insurances nowadays don't require you to be referred to our practice. You can come to our practice It's covered by your insurance, even if you had an eye exam. We're a medical practice. We don't bill vision insurance. We bill medical insurance. So if you come to see us, even if you saw somebody else the week before, it is still covered. We talked about if it ain't broke, don't fix it. If you're not having problems, you don't need surgery, but it works the other way around. And because of these advanced lenses, some people are coming in even before the cataracts are very bad. Some of the patients, and Jim and John, you've seen this. Sometimes I see people and they've seen 3 different eye doctors in the last year and had 3 pairs of glasses and they're not happy. And you know what? It's not the glasses and it's not that eye doctor. It's your cataracts. And so if you're changing your glasses frequently and if you're not happy, that's a sure sign you probably need cataract surgery. Now let's talk about the other situation. Sometimes you come in and you have some problems with your vision. It's not terrible because you're not seeing it great. And we look at the cataracts and we go, well, truthfully, from an insurance standard industry standard, the cataracts are not bad enough to be covered by insurance. Well, this happens a lot, especially in people in their 50s, and they can still pursue the surgery electively. Now, the elective word is a fancy word meaning your insurance isn't going to cover it and you pay privately. But a lot of people are choosing to do that. So it's called refractive lens exchange. So younger patients sometimes see us for LASIK surgery. Mid-age range between 50 and 60, they come in and have refractive lens exchange. It's a lot like cataract surgery. We can use bifocal implant lenses. Having that surgery now means you won't need cataract surgery later. And then some people wait until the insurance will cover it and have cataract surgery. But even if it's not bad enough to be covered by your insurance, you can have refractive lens exchange and have the exact same surgery, pay electively. And as per all the other things, we have really great financing plans that you have no interest finance plans or deferred interest finance plans that you can still have it done.
Those are great answers. I really appreciate you guys all jumping in to answer those questions because hearing from all 3 of you is great. I've got a few more. So what if you have had partially torn or detached retinas before and they've been repaired great? And do the exams help determine what type of lifestyle lenses that you would qualify for?
Jump right in.
Yeah, I'm happy to do that one. Yeah, I bowed out of the last one, so I think I guess this one's coming to me. Lakin, the question was, if you'd had, for instance, if you had a prior medical retina issue, like a retinal tear or retina detachment that may have had some sort of treatment, whether it's laser or even a full retina surgery, what lens are we able to determine what lens you're a candidate for? And
that's what I was trying to say.
Yep. The short answer is yes. So many people come to us having had retina surgeries or lasers, and we are able to identify those and make sure that they're still in good condition and haven't progressed. But most of our retina colleagues do a fabulous job of repairing those. So then the ball's in our court if the cataracts have developed to help you see better. And so part of your evaluation is kind of evaluating the health and the ability of your retina to see well. And so we do help guide and advise our patients of what lenses they truly qualify for. And sometimes, we'll have to cross off ones as a good option because we know you won't see well afterwards. But if it's only a mild issue, many times you still qualify for all the advanced lifestyle lenses as well.
Beautifully answered after horribly asked.
Great answer, John.
Do a standard lens in one eye and an advanced lifestyle lens in the other eye?
The answer is occasionally, and it may be a factor based on the health of the eye, the wants and desires of the patient. The big thing is to help them understand that each lens will work a little bit differently. So they have to expect a little visual difference between the 2 eyes because of the properties of those lenses. But the answer is occasionally. Typically, it's the same type of lens on each eye, and most patients do very well with that. But occasionally, you may have somebody who knows what to expect. We've talked to them and in detail, and they may choose to have one type of lens in one eye and one in the other eye. Typically like a multifocal in one eye, maybe a toric or a standard lens in the other eye.
The last question that I have right now is, what are the reasons that it would be better to come to see us at our practice than another general ophthalmologist or someone else who does cataract surgeries in the area? So what are the benefits of that?
Yeah. There's lots of places to go, and we've got great colleagues here in Dayton, and we're good friends, all of them in Dayton. What makes our practice probably a little bit different is Jess. No, it's our staff.
It is
Uh,
just.
Truthfully, the first person you're going to talk to is your staff, and the last person you're going to see is your staff, and the person who's going to schedule all of that is the staff. And the people taking care of you in the surgery center are your nurses and your staff. So yeah, our doctors are all board certified, our nurses are all registered, and our techs are all certified, and they're super smart. But it's the friendliness and the personality and the small practice sort of thing that makes this practice different than the other practices. Yes, we do a high volume of surgery. Yes, we're very experienced. Yes, we've been doing this 30 years, but it's the personalized care and attention that's different than any place else you're going to go in town.
Yeah, and I might even piggyback on that and say this practice is a little bit unique in the area. A little bit unique makes sense, but anyhow, unique because we provide full range of refractive surgery. So from as Dr. Stahl mentioned, from 18 up to early to mid 50s, you're talking LASIK probably is where somebody would fall into, and then mid 50s up to 60 or so until they develop significant cataract, refractive lens exchange, and then beyond that, cataract. And so we have the ability. Again, when people heal, there's a kind of a a normal distribution. Most people heal exactly where we want them to heal, but there's a small subset that might heal outside of the the one standard deviation either side of that middle mode there. And those patients may benefit from that laser vision fine tuning, and that requires a surgeon who is able to do that. And so each of our surgeons is able to do not only cataract surgery and very experienced at cataract surgery, but also laser vision correction. We're very experienced at that. And so we have the ability to not only have a higher likelihood of getting people where they want to be on the first time with cataract surgery because of all the formulae and things like that we use, regression analysis, stuff like that, all these other things that make us, I think, get great results. But also we have the ability to do the laser vision fine tuning if it's needed. Not needed very often, but if it's needed, then it's all in the same house. We do it here. And especially if somebody picks a advanced lifestyle lens, if there's a fine tune needed by the laser in that first year, there's no additional cost for that. So that's an amazingly good value.
That's a really big deal. It's something I'm really proud to say that we can do here. All right, we got a couple more. First off, Greg says, thanks for answering all the questions.
You're welcome, Greg.
Here, this is a pretty good one. How do they know who is actually going to be doing their surgery?
So when you call our front desk, typically they'll tell you which doctors are available. You can always request a certain doctor if you know them personally or you've had a family member or someone close to you, have a good experience with that surgeon. Many times it'll have to do with what your schedule's like, what day of the week you'd like to be seen, or who just has the next availability. So you will know who you're seeing that day as part of the process of getting a referral and an appointment.
You're getting a great one either way. So usually we just see what schedules work good for the patients, what days work really good for surgeries. This one is, how does glaucoma affect the possibility of the outcome for surgery?
Yeah, it's a good question, Lakin, and whoever's asking. So let's expand that. The question was, how does glaucoma affect your outcome with cataract surgery? But let's just expand. What about other eye problems? And maybe it's glaucoma, maybe it's a corneal scar, maybe it's macular degeneration, maybe it's a prior retinal detachment. And the best answer is, a lot of this is just very difficult to know until you come in. And as Dr. Knowles alluded to earlier, when you come in, plan on being here 2 hours. This is going to be the most thorough exam you've ever had. We have machines and gadgets we're going to measure with that you've never had testing with before. We're very thorough how we check things. If you have glaucoma, if you have macular degeneration, if you have any myriad of other eye problems, we're going to check for that. And then we're going to talk to you and say, hey, yes, you've got a cataract, but this may affect other parts of your vision and you maybe not see quite as good, or we need to do something a little different for you to make sure that you do get a good outcome. So the answer to the question is you need to come in for an exam. And it's going to be the most thorough eye exam you're ever going to get. We're going to go over all of your situation with you and how it affects your eyes.
I was just going to piggyback on that and complete my question from before for Greg. when you meet your surgeon for your evaluation, that's typically the surgeon that's going to kind of carry you through this whole eye process. So some eye centers and practices do what's called co-managed care, where you have your screening by a doctor, but then someone else may be coming in and doing the surgery, and you may never see them again. That's not much what Dr. Stahl said. That's where we are a different type of flavor of practice, where we see you through the full entirety of your initial evaluation till what we call your graduation. So it's personalized. Now, if there's acute issues, sometimes we see each other as patients to help each other, but your surgeon's kind of your quarterback for getting you through this process.
Yeah, you guys really do
Great
enjoy
answer.
seeing everyone from your start to finish, and taking your pride that you are the ones that got those results.
Just what Lakin said, we see you before your surgery, we do your surgery, we're gonna see you after your surgery, and we're gonna be here for a long time to come if you have any problems, take care of you.
That's right. Okay. The last one is more probably for me. It does go over, it just wants to know what the typical charge for an eye exam is to determine the suitability for surgery. I don't,
Jess, you're up.
I believe it's 190. It starts at 190. And then if there's additional testing, then that is added.
billable as well.
Is that
Yes.
covered by insurance, Jess?
Yes,
Subject to
So everything, yeah.
yes.
Yep. So everything
Your
goes.
mileage
through
Medical
Medicare.
insurance, as long as we take your insurance.
And the only 3 insurances we currently know we don't take is on our website.
Correct.
They're
And
not
if you
there.
guys do have questions about what insurance,
You can call and ask for Jess.
no, you can call your insurance company and just find out if Stahl Vision is listed as a provider for you. They'll know and they'll be able to
Jess
give
will
that
tell
to
how
you.
Kill you later.
Today's my last day.
All right, everyone. Well, we really appreciated having you tonight. If you do have any additional questions, you will want to give the office a call. Our telephone number is 937-427-2020. You can schedule an appointment with one of our wonderful surgeons, or if you just want to come hang out with Jess, she would probably love that. She has
Come
all the
on.
time in the world. So
Not.
I'm
I'm
just
usually
kidding.
doing nothing. I'm very bored.
Yes. But we do appreciate you guys being here and asking all the questions. Are really great. And we do always like to share our wealth of knowledge with you too. So thank you for coming. And if you want to catch this on the replay, we will have it posted to our YouTube channel within a couple days or so. All right. Thanks, guys.
Thank you.